say we have had three phases, more or less. One phase, which is, say, the rolling out of iPRI, where we started really to have a focus on more on chronic disease.
The beginning was amazing. A team of very good people, seeing projects coming where the team of people with very different specialties would just get together and tackle all the issues.
Then after has come what I would say some more challenging projects that were backed by the European Medicine Agency, the Food and Drug Administration, and other projects, for instance, for making, say, synthesis of immense public health issues like breast cancer in the world. And now we are getting to, say, a more mature period where junior staff has gained sufficient experience and skills so that they can really work on their own, I would say.
I think that it's easy to identify a problem and it's hard to come up with a solution because you need the intellectual more than the financial resources to come up with solutions. And so what iPRI has been able to do with Peter's Energy is to get a force of people together in different fields and look at not just what is the problem, but what can be done to solve a problem.
I have a general sense that we tend to be very traditional in who we look to in terms of global health leadership. Too often countries look towards the World Health Organization, the United Nations, many what I would call sclerotic, old school structures that really were fine when they were set up to deal with a world 50 years ago, but they neither have the intellectual capacity or capability or indeed the technical know-how or operational know-how to deal with today's problems. And the organisations like iPRI are really the ones that are able to deal with today's issues and problems within global health and global public health. And really they act as, I think, a sort of a model for how we should be thinking about nimble, exciting, sustainable research and policy partnerships going forward.
What iPRI can do that so many other organizations cannot do is actually look at the evidence in a very objective way without the influence of outside financial pressures and actually say, this is what the science says, this is what we need to be doing.
iPRI has a very distinct role in the world. The way they've brought medical knowledge, data analytics, understanding the economics of medical policy, medical science, the application of medicine to people's lives, critically important. In many ways, they've defined that nexus between medicine, policy, and social impact. And I think from that perspective, iPRI has a very unique position and as a consequence offers enormous value to the world.
Well, one of the characteristics of iPRI is the international and multidisciplinary nature of the clinicians and scientists who are involved. This, I believe, provides high quality data, insight, and the ability to sense check and question concepts and approaches that might be considered.
It's really a unique structure in terms of the wide scope of his interest, the value of his staff, because iPRI is a staff which is now able to adequately conduct and interpret the most epidemiological findings.
iPRI is able to transform quantitative science in applied science to solve practical problems of public health, both mathematics, statistics, epidemiology. Here we know how to apply theoretical methodology in the practice. I think this is a very important peculiarities in positive sense of the iPRI.
iPRI is an amazing institution. So what comes to my mind first is that this institution has an excellent team, so excellent people working there. Second is really this non-bias approach. I really love that. These people, they approach things without bias, just looking for the very best solution, for the very best outcome, for excellent quality.
This is a very important organization. It brings people together. It touches problems which are not sort of looked at by other organizations.
You know, to pull all those kinds of partners together and make them not only feel welcome, but part of a whole contributing to a greater good, I think that's one of the great strengths.
The translations between high-level science to practical public health issues.
What is unique with iPRI is the fact that it takes care of missions that are really important, but does it with a lot of independence and flexibility. And
they have some of the best people in the world, people that really dare to face the difficulties and that make the difference where they are. So we see people coming from different countries, and these people are doing the best they can to change the world.
I think we're on the right track. I think partnerships are the way to go.
Probably its biggest strength is the huge network of senior research fellows, where iPRI can draw on strength from all over the world in different areas, be it medical, cancer, patient care. And that is the aspect of iPRI which probably distinguishes it from most other research organizations.
I think Peter has done a remarkable job at pulling in people as senior fellows. I think that adds tremendous strength because he can take the people he knows that are dedicated to this field, interested at a point in their careers where they can make a commitment to do something, either on a short-term or long-term basis. So I think it's a diverse group, very exciting from all over the world.
The great strength of iPRI is that we have an international team here in the office, but we can always ask some more advice or more guidance from our senior research fellows abroad.
I have collaborated with iPRI since the inception of the Institute. We've worked on a number of projects, including looking at dietary risk factors for human cancer. We are continuing our work in the areas of drug safety and efficacy. We have a number of other opportunities that I'm looking forward to continuing that long-standing collaboration between our groups in Ottawa and the Institute here in Lyon.
The network is very enormous, and it was my first impression when I arrived here, and it is still the same today. It's crucial. And I think it's really a strength of the Institute.
I am very proud that IAPO has the official collaboration with iPRI, because I think it's a two-way collaboration. We provide a patient experience, a patient way in the treatment, and iPRI gives us power, gives us research, gives us all necessary data, information, academia, background.
Since 2016, my hospital and iPRI signed MOU in which we cooperate in research and training in cancer.
Because there's no other meeting that I know of that is quite like this one. Because I'm a gastroenterologist, I tend mainly to go to gastroenterology meetings. You meet the same sort of people with the same sorts of interests year in, year out, which is great. But at the same time, this is a meeting where you meet entirely different people. You meet people from all over the world. I'm probably the only gastroenterologist at this meeting, I imagine. So there's people from all over the world who are linked by their concern for and their knowledge of and their experience of cancer with them. And I think I have learned so much from this meeting that I've been able to take back to Pakistan and implement some changes and so on. And it's just great. There's no other meeting quite like it.
So to come to a meeting like this that iPRI and the National Cancer Institute directors put together every year provides a very, very nice opportunity to bring myself up to date with experts in the field, but folks who also have a commitment to the communities and the patients that they're serving.
We have so many directors of the Cancer Institute coming to this meeting, which is superb, and getting examples on how they solve the regular problems that find one place or the other. I think this is a forum where a lot of new ideas are created and good messages are taken back. I am sure many institutes have changed policies after coming to this meeting and seeing how you can do something in Thailand that you didn't think of and can be done in Peru.
There are different levels of people attending and the experience are different. There are people who are the first day of fighting against cancer. There are others who have made 50 years and more in the fight against cancer. So putting those people together, I think everyone would learn.
And this meeting, for example, is a group of just amazing, amazing people who have tremendous gifts and can help us understand cancer in ways that just couldn't happen unless you did something like this.
It has long been important for Lyon to have a strong health activities that are useful not only to Lyonese patients, but to contribute to the international effort. So we are extremely grateful to have the center of this worldwide activity on prevention in Lyon, because this is the main factor to develop not only international prevention, but to convince also French people that prevention is the goal for improvement of health in the future.
One who touched me, it was Africa, the project in cancer in Africa. It was really important for me.
In recent years, the iPRI report on the state of cancer in Africa was a seminal piece of work. I think their understanding and their presentation of the lack of treatment and the importance of us translating what we can do in terms of drugs and policy can make an enormous difference. And indeed, it's what iPRI does. It does things that are useful, it does things that are impactful, and in particular, that report is a very important representation of what they do at their very best.
The project that inspired me is Cancer in Africa, because cancer is attacking Africa, as we can see in our film. The film is quite shocking because we can see her suffering and before she died.
Having had some first-hand experience working in rural Africa, for me, the most significant work in terms of the importance of the subject and the potential reach and effect has to be the project addressing cancer in Africa. The desperate inequity of oncology provision is thrown into sharp relief, and the new cancer code for Africa has great potential.
I think this state of oncology in Africa, this is the most powerful report I have ever read.
So the first thing I did when I came at iPRI was a meta-analysis of smoking and breast cancer risk. So I found that very interesting as a first project to do. I think the projects that I'm not a part of, but we do at iPRI in post-authorization safety studies for medication are very important and very interesting to follow.
iPRI had an important project on diabetes treatment and possible side effects of medium long-term insulin glargine, which is the most common type of insulin used on subsequent breast and other cancer risk. And I believe the contribution of iPRI was really important for reassuring the millions of diabetic patients worldwide who used insulin glargine.
I worked on a project on physical activity. And it was really interesting for me because I'm a sportswoman, so the link between physical activity and disease really interests me.
There's this project on food consumption and its impact on breast cancer and colorectal cancer. And we try to assess the number of people that would need to change their diet to achieve a certain number of, save a certain number of cancer cases.
I focus on a prospective cohort study of long-term safety about the most recent oral treatment in multiple sclerosis patients, in collaboration with some of the most important multiple sclerosis center and registry in Europe.
There is the diabetic retinopathy projects, and we have been working with doctors and screening centers in Wales, in the UK, and with them we have developed a new techniques to facilitate the comparisons of these images in order to better detect on the same patient across years the evolutions of the disease.
The one that I think is, to me, has been most eye-opening and important has been the stuff on breast cancer screening and showing that the trials which appear to show benefit are probably, there's a problem in the design which is undermines the conclusion, and therefore it's been part of now what is a really quite widespread view that perhaps general population's breast cancer screening is actually probably doing more harm than good and therefore should stop.
I worked on a project on rubber, which was very interesting because it included different countries and different nationalities, so it was interesting to see how they can all work together.
Our sugar study was very interesting because it involved going through an incredible amount of literature. I remember getting the team together and making sure that we were going through all these papers and doing the proper classification and then doing the meta-analysis. This was very interesting, but also the lessons learned that sugar in itself is not really the problem, but physical activity is so important.
And of course, I worked with Philippe Gauthier on breast cancer, which is still ongoing, and we managed to get some great results already.
I would say the last one is an article that was published in Diabetes Care on the association between use of incretin-based therapies for the treatment of diabetes with pancreatic cancer.
iPRI studies are mainly focused on the large-scale epidemiological studies, and most of them are very important. But I'm very much impressed about the diabetes relationship between diabetes and the pancreas cancer, because pancreas cancer is the most intractable cancer right now, and the number of the patients are increasing, even in a country or in the world.
The studies on sun exposure were interesting. It's interesting because it wasn't obvious that we could make people understand how the sun that everybody enjoys so much could be dangerous to you. And it was also interesting to finally convince governments that something had to be done about sunbeds and things like that.
Last year I worked on an European project with Alberto and Alina, the ASSET project. Very challenging because very new for us. It doesn't involve biostatistics. It concerned identifying best practices of involving civil society during pandemics and epidemics. So
iPRI has done a huge number of really important studies, both in terms of research and also building the global movement. I think for me the most important piece that they actually ever worked on was interesting. It was an amalgamation of research. It was their report into the state of oncology in Africa. Because I think for the first time what iPRI was able to do is stand back and through the sort of critical lens of research and also humanitarianism, they were able to really examine the true impact, not only financial and more broadly in terms of health systems, but the true personal impact of cancer in Africa. And I think it's fair to say cancer in Africa has just not really appeared much on the global health radar. And really the report was the first one to firmly nail cancer as a major current and future threat to nearly every country across the whole of the continental Africa.
A health system, you have two levels of health system. You have the policy makers and the rich. They go to foreign countries to treat for treatment, and you have the poor people with a very difficult health system, no access to medicines or to specialists, and this cannot continue.
This is absolutely non-acceptable reality that they have none or only one radio machine in these countries, and I think more than 30 countries have none at all in sub-Saharan Africa. So this is not acceptable.
It's one of the reasons that I'm very supportive of iPRI, is that it concentrates on the countries with the lower income.
What's really stood out for me with iPRI's focus in low resource settings is this idea of solidarity. It's not being done in a predatory manner. It's not being done as high income showing low income how to do things. It's a matter of sort of being a friend and a partner with colleagues and partners in low resource settings and saying, okay, what agenda, what research really needs to be done? And then how do we go about doing this research, which is actually going to change practice and is going to change policy, both at national and international level. And that's a unique approach, and also it's the long-term sustainable partnerships. The problem is most of the research we see nowadays is very short-termism, and it's driven by the needs of publications, about generating more income. It's not about really having long-term 10, 15 years partnerships with countries and institutions who will actually change things. And I think iPRI's really nailed it where that's concerned, which is to build it on some really sustainable partnerships.
iPRI is a very important part of my life.
I would like to thank Peter because it's really pleasant to work in a good environment and with good relationships, as I said before, like a family.
As I said, for me it is more than a workplace. I'm here with friends. Half of the biostatistics teams were at my wedding, so.
I think one of the successes of iPRI is its people. It has very strong leadership. It has a strong cadre of senior scientists. It has expertise at all levels. It has a wonderful network of affiliates and collaborators, of which we're pleased to be included within that network. So I think the human resources available at iPRI are second to none in the field of global public health.
The team is incredible. The local team, but also the network that we have with incredible expertise worldwide. So we have really a wonderful team.
he's always traveling. Every week, every month, it's always something.
I think vis-a-vis Peter, one of the things that's really important is his ability to lead people and to generate enthusiasm for projects which you might never have thought about.
Oh, I know Peter for ages, probably already for 30 years, probably even more. Peter is a very talented person and very dedicated to his purpose. And also, of course, it is very important, he brings people together.
Everything he does bears the hallmark of the excellence that he's always been able to produce, whether here or in other places. Peter has the advantage with iPRI of being able to put the science first and using that to shape the kinds of issues and programs that he works on. Everything is a compromise just by the nature of things. Everybody has their own interest. But Peter's interest is in promoting the science and putting that into policy. I think that's one of the things that I like most about working with iPRI and observing what happens here.
Initially, I think it was, we tried to recruit him to Oxford when I was, I think I was head of the medical school at the time.
Well, Peter would be embarrassed if I say this, but he really is a force of nature, and he is iPRI, and he had the intelligence and foresight to bring a group of people together and to look at evidence-based medicine, epidemiological studies, not just in Europe, not just in North America, but really, truly globally, and especially his efforts in looking at low-income and developing nations and looking at the incidence of cancer and non-communicable diseases has really been a tour de force, and there are very few people in the field of medicine that I admire more than Peter Boyle. He's really been an amazing person.
Well, first of all, it's Peter, at Peter's vision. It's amazing because I think he uses his academic and professional very good skills, but also his passion and heart.
So Peter Boyle is a force of nature. His dedication, his professionalism, and his unbounded energy is absolutely attractive. He enthuses everyone about the challenges that iPRI are facing. He brought me in as an engineer to understand the importance of their work, and Peter epitomizes everything that's right about impactful research.
Peter Boyle is a generous man. It's a great. This man is a giant. He has the great and the enormous heart.
Professor Peter Boyle, a man of immense capacity, and I have always found that when he talks, I listen, and when he talks, I usually think he's making sense about a difficult and clinical problem.
We're only just getting started, so I would like to do a lot more in the future, but it's important to contribute in some way to improving health and equity in health around the world.
This year and last year, I think there's been a lot of talk on the pathways, and I think that would be a very useful thing if we could collaborate with iPRI to have cancer pathways which were widely accepted throughout the country.
In this moment, worldwide, there is some sort of epidemics of depression, for example, or work burnout, family burnout. It's very important to act, to prevent this and to control the current epidemic.
I think it's important in the future to apply the lessons and knowledge we have from clinical trials, for example, randomized trials, to interventions to better health in lower middle income countries.
Another field more specific is in the field of infectious disease, the problem of the antibiotic resistance. I think that not enough is done in this moment.
Over the last years, we have intensively collaborated in the field of cancer, and by doing that, we all realized that there's still so much to do. So I would really recommend to continue the great work around cancer.
iPRI has been so well managed and so widely focused that it's difficult to improve such a structure. It is possible that maintaining the focus on middle and low income countries will become more and more important.
If I was asked to set priorities for iPRI's future activities, I think that looking at cost-effective solutions to reducing morbidity and mortality in the context of global public health would be a key priority. As I said earlier, building on work that's been done by various organizations, pulling it all together. iPRI is very, very good at pulling together networks of leading investigators all around the world, and could probably come up with a very well-grounded blueprint that would serve as priorities for global risk reduction.
I think personally there is still the great challenge of cancer and diabetes, which are exploding in many low-income countries, and this is a great challenge because in these countries they are not yet prepared to treat and to deal with such a disease.
Because I've been a mom since a year now, so many questions raised. How should I feed my child? What can I do so he doesn't develop allergies or asthma? Or how do I manage to not get him obese? So for me, a project around global health in children would be very interesting.
I would hope that we continue to improve screening. Screening is, I think, very important in the health area. We've done a lot of work in screening. There's probably more to do.
I'm very interested in Alzheimer's disease. I think it's one thing that is not, I wish I never have to deal with this. Whenever I hear stories, I'm very interested. I look on research and everything. I would like to have a project on that, if possible.
Tobacco and alcohol, the two illicit drugs that are really damaging people very much.
Developed our international partnerships, and for sure Strathclyde would look forward to being one of those partners over the next 10 years of the work. But think big, be confident.
I would like to see iPRI continue its focus on good, well-grounded science, continue its focus on people understanding other people's problems. We need to know, we in the United States need to know and understand what the cancer issues are in South America, Africa, Asia, and Europe. And I'd like to see folks from those places understanding each other as well. That's something iPRI does very, very well, especially through its NCID meeting every summer. I'd like to see iPRI continue doing very solid epidemiology, a very hard science, coming up with what is the real truth. I'd like to see iPRI also do some publications on this is how we should control cancer. These are the things that we need to do in order to control cancer and chronic disease in general.
I see at least three big area. One is for sure more into the low and medium resource countries, and essentially in increasing their information capabilities, so that they can at least gather the necessary data and information for taking care of huge health problems that are now emerging there, which is the chronic condition, essentially diabetes and cancerous diseases. Another great area is certainly to continue working in the safety and effectiveness, the value of the new therapies. Many therapies are now proposed for a large number of chronic conditions. Then there is a third domain, which is basic a bit to our roots, which is the domain of cancer, cancerous disease, where we'll continue to have these population-based, essentially, approaches, where we can provide the best science regarding how screening works, how preventive policies are, whether they are effective or not, or whether therapies are really bringing a difference in terms of patients' quality of life, survival.
I think there's at least two answers. I think that the particular approach which Peter Boyle is taking at the moment, which is to look emphatically at the issues of global health, I think is a very important one. It is a major exercise for the world, that cancer is a terrible problem in low-income countries, low-resource countries, as it is for high-resource countries. So the lessons we learn in one, we can apply in another. So that's the first area. But I think there's another role for iPRI which it should maintain. That is being an adaptable, an independent, an intelligent, a flexible, an innovative organisation which can deal with problems which are put to it. So I do believe it should have not an entire focus on global health, but be out there and thinking about the problems which are still extant in the world that we work in. And there are multitudes of those problems, and it requires an individual and, as I mentioned, an innovative way of looking at these to make a difference.
The more I see about the needs in a lot of different countries around the world, the more I see that their help and their advice is likely to continue to be useful and valuable to many countries for a long time to come.
I will surprise you, because it's not a scientific word. The word is family. For me, iPRI is my family. For me, Peter is not only my president, but a very dear friend. And as I said, one of the secrets of iPRI is to obtain the best from its employee without pressure, but on the contrary, I feel here as at home. Maybe you can understand if you watch my office, which is in very disorder, like my office in my home. But here I feel happy.
We are a family, so that's what I saw the first time. I felt like I'm working here like 10 years already, and I'm just here during 1 year, so
I would say family. Because at iPRI there is a good atmosphere, and this is really important for work and really motivating.
So yeah, I've tried to think about it, and I got stuck with opportunity. So I thought of that, and then nothing else came to mind, so I'm guessing I'm going to tell you, when I think of iPRI, I think of opportunity. Career opportunities, project opportunities.
A global leader in networking. Networking is the word I would like you to focus on, because I have just been very delighted to see how successful iPRI has been in pulling people together from all around the world, building new associations, building effective research partnerships, building effective public health initiatives, and really make a difference through its international networking.
Dynamic. I think that iPRI, because it's not a governmental agency, has the flexibility to look at a problem, figure out what a solution might be, and move on from there. Look at the pieces that it might take to put together, and then help convince people that this is something that makes sense.
Efficiency. I don't know of any other international organization that has such an efficiency in terms of prevention.
Impactful. Because what they do is spreading in the whole world.
Reliable and independent.
that's what's impressed me, and I think it's impressed many others who have joined forces with iPRI over the years, that the work is done in a completely independent way. You can rely on the facts as set out by iPRI.
Essential. What they do is quite unique. What they do has a fantastic history of outcomes for the benefit of mankind. And I would say that is what we should recognise them as an essential part of the infrastructure of thinking and policy making.
A learning place, is a school of giants, of people that have overcome their limits. And so for me, it's like sitting together with wonderful people that are really trying to change the world, and they are trying to shape the new words that we have to have in the future.
Prevention, yeah. There is a very big job here regarding prevention.
Prevention. As you know, the worldwide cancer strategy is composed of four folds: prevention, screening, treatment, and palliative care. But under the limited economic resources, I think the most effective goals come from the prevention and the screening. And so iPRI focused on the prevention. That is very, very good.
iPRI is an organization that is independent, and you can trust the research that they do. Sometimes you may have organizations that are paid to do research, say by the farmer. And whatever the results they get are results that the farmer wants the public to know. But iPRI is independent.
If I could use two, it would be intellectual and practical. What I see so frequently as we look at cancer science and indeed medicine in general is a lot of people who are very concerned about one specific issue usually, and they don't really know the underlying science. And so we see a lot of well-meaning people who are doing inappropriate things, sometimes not even realizing that they're doing things that actually worsen the thing that they're advocating to try to fix.
Solidarity. iPRI shows real solidarity with patients and with clinicians and with researchers in the countries, the weakest countries, the countries which are most affected by disease, by war, by poverty, in a way that a lot of other organisations simply don't do.
La grandeur d'un métier, c'est peut-être avant tout d'unir les hommes. The strength of any profession is arguably to bring people together. And I think that's an important aspect of all our work in public health, that we can't do it alone, and we've got to do it in collaboration with the best experts in different parts of the world, and that's very important for us. I'm grateful that we have managed to bring together leading experts from many parts of the world in many different areas of disease and health to work together to try and improve the quality of the work that we're able to do. The other aspect which I think is very important is that we've had the opportunity to develop and grow junior faculty. I hope also that we've had an influence on the activities of these collaborators, because working together, I think that we've done something which is really quite important as an institute, as a research institute, in moving forward the needle of international public health. The most important one is to reduce the disparities in health delivery and health outcome throughout the world. It's incredible today, the situation that exists, for example, in Africa, where we do a lot of work, to see that so many people are denied access to care and access to drugs for reasons which are financially very simple to resolve. Problem is, we need to have more doctors and more nurses and more infrastructure there in order to deliver. but it's shocking to see the disparities which exist. Africa is also very important for us because we've got a collaboration with the University of Strathclyde, which is one of the major technical universities in Europe, and they've got amazing programs on sanitation, clean water, electrical power, bioengineering, which are relevant, very relevant to the situation in Africa. And the bottom line is that health is much more than the absence of sickness, and we've got to think more of the quality of life and the well-being of populations around the world, and that's something which we're very much engaged to be involved in. I think that's important. It's also important to recognise that change doesn't come in a flash like that. Change is a result of steady forward progress and momentum. Health is not a competition, and there's too many institutes, too many groups, too many international organisations who see health as a competition. It's not. And we're driven by a large extent by the words of the great Irish author George Bernard Shaw, who said that if I have an apple and you have an apple and we exchange apples, we've still got one apple. But if you have an idea and I have an idea and we exchange ideas, then we've each got two ideas. Health is not a competition, it's not a secret. We've got to share ideas, and if you've got two ideas, you're likely to do something much better than if you've only got one. Our core values are quite straightforward. They're on our website. They've always been on the website since the beginning. The core values are independence, transparency, integrity, impartiality, and timing. I would really hope that everyone who looks at what we do believes that we're trying to make a positive impact and do something positive for people's health throughout the world. The time for writing reports and assembling committees, that's long past. And what we need to do is action, and all of our activities is related eventually, directly or indirectly, to patients and patient outcomes. That's why we value so much the work that we do with the International Alliance of Patient Organisations, so that the patient voice is heard in all our studies and we listen to the patient voice. I would like to think that when others look at our work and look at our input, they know that, they believe that it's done impartially. There's no external influences from funders or other sources who influence our findings, and that it's done to the highest academic level. And that's all we can aim for.